I'm Edie Lush, and I'm here at the Hub Culture Pavilion in Davos at the World Economic Forum. Really pleased to be joined by Graziella Pelligrini. She's the head of cell therapy program at the University of Modena. Tell me first of all what you do.
So what we have developed over the last 10 years, more than 10 years, we obtain a culture system in vitro to reconstruct from a very small biopsy taken from a single patient to isolate stem cell in order to have the corneal surface of the patient completely reconstructed in vitro. This allows to recover from blindness to a specific category of patient and can be done in a little bit more than 2 weeks. This is, I believe, the clearest example of regenerative medicine and personalized medicine, since the single cornea of single patient can be reconstructed in vitro. The important point that I think we should highlight is that this treatment was maintained under observation for over more than 10 years. And so now we are proposing this treatment that was officially approved by European Medicinal Agency for the distribution in Europe as the first stem cell therapy product, safe for treatment of patients and authorized by regulatory bodies in the world. So I think it will become a treatment for all the patients that need to recover from this type of blindness.
It's fascinating. How wide do you think this regenerative medicine, using the stem cells, how many different cases of blindness could you think you could use it in? Well,
what I think is it is important to start with a very well-defined category of patients, since we have many variability between us in our genome, and it is very important to define very well one category, understand very well the variables. Some time is needed, but this increases the level of knowledge. Then, just changing few variables, we can move to other categories of patients treating other disease. But we have to define step by step, since science is slow and we really need to increase the knowledge to be able to control our process.
Right.
In this way, it will be safe and effective on patient with very high success rate, because we reach over 70% success rate, and it's not my personal opinion, it was validated by scientific community and by the regulatory bodies. So, but this means that you define very well what you want to see, your clinical outcome, you measure precisely your results, and then when all the steps are clear, you move later on the other categories of patients. Theoretically, many diseases can be treated with this approach.
What do you think? What do you think about regenerative medicine?
It means reconstruction of part of the body which are missing or that were lost due to accident or pathology. But even some degenerative disease that can be due to that are due to genetic defects, because we know that we have now a lot of new molecular science and molecular therapies based on modification of a small part of the genome in a very precise way, because the techniques are increasing, and we can modify some specific parts which are defective in our genome and make the patient in a better shape. Make the patient feel better and found, being able to run a normal life instead of being always dependent on family care, social care, and some symptomatic treatment, as it is most of the time with the classical drugs.
Graziella, thank you so much for stopping by the Hub Culture Pavilion here in Davos, and I'm Edie Lush.